Hey, welcome back. We got the folks from Optimize Physical Therapy. They're going to be going over some movement patterns specific to firefighters and kind of how to address some of our dysfunction. This is Dr. Zaki.
Thank you, Tony. So just a quick introduction on us. Like Tony mentioned, we're from Optimize Physical Therapy Performance. I'm Dr. Zaki. This is Dr. Jeff. And a little story about how we kind of started the practice and the kind of whole philosophy behind it. I began the practice about 3 years ago with the whole intention of elevating the level of healthcare in the whole Las Vegas Valley. I saw there was a big hole in the way people are being provided care, whether that was firefighters, general athletes, or people just wanted a higher level of care, and there wasn't really a place to go. So we started this practice with them in mind and to help them out with getting a healthcare practitioner that really cares about them enough to learn about their life, to know the specifics behind their job, their lifestyle, and treating them accordingly as a person and not just the shoulder pain or back pain that they come in with. So over the past couple of years, we've worked with probably over 100 Las Vegas firefighters in the Valley. And we've seen recognizable movement patterns that firefighters more typically undergo and the problems that can occur because of that. So we're gonna talk a little bit about specific dysfunctions that we see with firefighters. And with that, we're gonna talk a lot about a couple myths that we've seen out there and some information that I think most people can use. And then I'll let Dr. Jeff kind of start with that.
Hello, my name is Dr. Jeff, obviously physical therapist. I'm going to talk to you a little bit about low back pain specifically, mainly because low back pain is super prevalent in your guys' profession and in the entire world. 80% of the population in this world is going to deal with low back pain at some point in their life. That's the entire world. That's like 7 billion people are going to have low back pain at some point. And more specifically for you guys as firefighters, back injuries account for up to 50% of all line of duty injuries and retirements each year. So what does that mean? All those early retirements that you hear about with all your brothers, 50% of those are likely due to a low back injury of some sort. And lastly, back pain is non-specific. What do I mean by that? So there's different variables that incorporate to allow back pain to fester and manifest in your body. So it's not just, oh, this little muscle right over here is a little bit strained, I've got low back pain. Sure, it can be, but low back pain is accumulation of a lot of different things of physical stress, no sleep like we've talked about, poor nutrition, high stressful environments, and emotional environments. I don't know about you, but I could think of an occupation that kind of entails all those things. Firefighters. So knowing that low back pain is non-specific, it's going to be super important for all of you guys to be proactive and not reactive about your recovery and about your prevention of this. You guys all chose to be firefighters. You know you have sleepless nights. You know you're in a high stress environment, and you know you have super physically demanding things that your body has to do on a day-to-day basis. So it's super important for you to seek out care, seek out what you need to do to take care of this and not wait for it to come and help you later on. If you're chasing low back pain, it's going to beat you 9 times out of 10. But if you get in front of it and prevent it, we can do that almost 10 times out of 10. So how do you do that? First things first is it's really good to have a vital and strong support system. Lucky for you guys have a brotherhood, and you guys were born into a strong support system. You've got brothers and sisters surrounding you constantly day to day that you can shoot ideas off with, ask for help, get a referral to someone that you know has helped you in the past. So having that strong support system that, maybe you need to be a little vulnerable with somebody, having that person or the group of people that you can constantly go to for support is really important to preventing this kind of a pain from becoming like a chronic long-term pain that leads you to an early retirement. Secondly, it's really important to have a great medical team. To take it one step further, it's important to have a medical team that knows exactly what you guys do and the different things that need to be rehabbed or corrected, so you guys go back out into the field and are prepared for the demands that your job requires. So let's take, for example, you guys know Tony Clinker. If not, he was the extremely large man that could snap me in half that introduced us. If he comes into a physical therapy clinic and let's say he hurt his shoulder, and he comes in, gets his evaluation, and the guy says, yeah, cool. Let's get this guy rehabbed up. Let's have you go into the corner. Let's grab this little yellow TheraBand over here, and let's do 2 sets of 10 this way, 2 sets of 10 this way, 2 sets of 10 this way. We'll get you back, throw an ice pack on you. We'll get you feeling better. Maybe he feels a little bit better, but let's say 3-4 days later, Klink's got to go out into the field and throw a 300-pound woman over his shoulder and run out of a building. How many of you think that those TheraBand exercises and that ice pack really prepared his tissues and his body to make that happen? And he's going to be able to do that safely. I'm going to probably say no. So super important to find a medical team and a place that knows what you guys do, the demands of your body, and can train you to get back specifically for what you guys do in the field. And third, you have to maintain peak physical performance. Sprains and strains are the most common injuries in low back, and they can be prevented. And so in order to do that, we want to ensure that you have adequate range of motion and mobility in your spine. So think about a short runway and a long runway. Oh, I probably shouldn't take that far away from my face. Sorry about that. A short runway and a long runway for a plane. Short runway, that plane isn't going to have a lot of time to do what it needs to do to get to full power, to do all the correct safety measures before it takes off. Now let's say you got a long runway. Now that plane's got adequate time to do everything it needs to have a safe departure from that runway. Same kind of thing works with your body. You got to give your muscles, you got to give your joints, you got to give your tissues adequate time to produce that force and power and stabilize those joints that you need to in order to perform those movements that you need to do safely and efficiently. And second, you have to ensure that you have adequate strength in the muscles that move and stabilize the back. I know a lot of you guys will think like, yeah, I squat, I deadlift, I'm good. Well, if we worked in a perfect one plane motion of just doing this kind of motion, you're probably right. You would be fine. But out there in the field, there's twisting, there's turning, there's bending, there's hiking. Training the muscles that do all those little small intricate movements as well are equally as important to preventing low back pain rather than the big, huge, bulky muscles that we want to focus on like squats and deadlifts. And thirdly, we have to ensure that you can produce adequate power. So the strength is important, but power adds that speed factor into those motions as well. You guys as firefighters, you don't just lift or perform activities in a nice, slow, smooth motion. Sometimes you have to move quickly. You got to throw an axe super quick. You got to throw a ladder over your shoulder super quick. Pick somebody up super quick. Run, jump, all those kinds of things. You have to train your tissues to be able to handle those kinds of forces. They're a different kind of force that the body has that has to be able to produce in order to prevent injury. If you're not prepared to produce a movement with correct speed on top of correct strength, that's when things go snap, pop, and crack, and that's not what we want. And lastly, I want to talk a little bit about posture. A lot of people that have low back pain, chronic low back pain, are told, well, maybe you're not sitting properly, or maybe I need to stand properly and stand with the perfect posture. Well, I'm here to tell you that there is no such thing as perfect posture. If I sit at the desk like this and I'm typing, you would say, yeah, that looks awful. That's probably not a great posture. But that becomes not a great posture when I sit in that position for 3 hours and don't change that position at any time. It's the same thing with your perfect posture too. If I have you stand up like this, nice and tall and nice and extended, but you don't move out of this position for 3 hours, I guarantee your low back is not going to feel any better. The important thing is to be able to move in and out of posture efficiently and smoothly. That's when posture is the most important concept to do to decrease the low back pain, not to stay in it for a certain amount of time. That's when posture becomes poor posture. So the good news is that everything I just talked about and low back pain in general is modifiable, it's correctable, and it can be changed. You're not stuck with this inevitable future that I'm going to get low back pain because I'm a firefighter. No, that's not the case. Anything can be changed in terms of the biomechanics, the strength, and the conditioning of the spine. You guys just need to implement some of the things that we talked about, seek medical help when you need it, and that extra little bit, if you've got a question, if it's just not getting right, there's professionals out there that know what they're doing and can help you get the rest of the way. And if you do those things, I guarantee you'll enjoy a well-earned retirement. Dr. Zaki, the owner of Optimize, is going to talk a little bit about the shoulder now.
Thank you. All right, cool. So kind of piggybacking up what Jeff was talking about, I think the biggest thing I want to get through with my time here is instilling the beliefs or breaking down the beliefs that some people have about their bodies, especially when they've dealt with pain for quite a while. So the term I kind of use around the office and with my patients is beliefs drive behaviors and those drive your outcomes. So say your outcome is to live a pain-free life and functioning body, right? And the behavior you have for that, having good exercise routine, good diet, good sleep, and the core of those, you do those things because you believe them to help. But if you've been on Dr. Google searching up stuff about your shoulder, about your low back, and you see the belief is, because you have a torn rotator cuff or because, my discs are blown out in my low back, then the behaviors are going to be different. You think you need to get fixed. You think you need to see a surgeon to fix these things before you feel better. Whereas most of the time, that's not the case. So I want to kind of tackle those beliefs first and start breaking down some myths when it comes to shoulder pain. We'll even talk a little bit about knee pain as well. So knee pain after low back pain is the next most prevalent, and then after that, shoulder pain in terms of incidence of painful sites for firefighters. So with shoulder pain, a couple of things that some practitioners will tell you about is that they think it's your scapula not moving properly, scapular dyskinesis, right? And the first thing is, to the naked eye, one practitioner can't tell a difference between a couple degree difference with one shoulder blade versus the other. So a lot of times the person assessing you under these conditions cannot tell that difference to make that diagnosis in the first place. Second of all, the scapular dyskinesis, which means one scapula moves a little bit differently than the other, is completely normal in almost every single person on earth, right? We have one dominant shoulder, usually sits a little bit lower, one non-dominant shoulder usually sits a little bit higher, so the movement patterns are going to be different based on your activities, not because you're doomed because one shoulder moves a little bit differently than the other. So when it comes to knee pain, shoulder pain, the body in general, asymmetries are perfectly normal, and you don't need to chase asymmetries to feel better. If one shoulder moves a little bit less than the other, okay, we can get some shoulders moving better, a knee moving better, a low back moving better, but you don't need to be perfectly symmetrical. Asymmetry is a foundation of the human evolution system, right? There's a reason why our heart is only on one side of the body. One side of our lungs have an extra lobe, the other one doesn't, right? We only have one spleen over on one side. The stomach is shifted over to one side. We are built asymmetrical, so chasing symmetry is usually a road that will kind of lead to more frustrations than anything else. One of our previous presenters, actually Chief Abercrombie, was talking about not being a perfectionist when it comes to reducing your stress levels. And that kind of goes along the lines of that. If you chase perfect symmetry, first, you'll probably never achieve it. And second of all, you're going to be adding in that perfectionist mindset that's just going to lead you down a road of more stress and more not being happy with your own body and your own self. So, and it seems like something that, I should be up here talking about, biomechanics and stuff, but if you could have the perfect moving body, and it can still have pain if you don't look at the other factors. Right? In our experience in the research that we've seen with biomechanics, we've seen that movement preparedness trumps movement quality. You can be the absolute best ladder thrower in the department, but if you've never prepared for that activity, you're going to have a harder time than even that sloppy person that throws that ladder up if they've done it 1,000 times, right? There's marathon runners out there that have atypical running form that are world record setters, right? There's people out there lifting 4 times their body weight in a deadlift with severe scoliosis. So the way your body's built shouldn't limit the beliefs you have in your body and what you can possibly do. It comes from your preparedness, and your overall self-image of your body is a big part of that. So that's a reason why I wanted to talk about that. Other things that we know about the shoulder specifically is some people think they have impingement, subacromial impingement. As I raise my shoulder up, there's a space where my rotator cuff tendon sit that's getting pinched down. Anytime you hear the words pinch or impingement, things like that, you want to take it with a little bit of a grain of salt, especially if a practitioner is trying to push that on you as this is why you're dealing with it. Our body is made to be pinched, squeezed, and nerves and tendons are made to be able to do that and handle that. Every time I sit down, I'm pressing hundreds of pounds of force on my sciatic nerve, but not everybody's walking around with sciatica, right? So how can one little pressure point in your spine explain the symptoms going down your leg, right? So understanding that it's not a very simplistic view we should have on symptoms. We should be looking at you as a whole person. Same thing with the shoulder. That space that the rotator cuff tendons sit in, it's called the subacromial space. And when you raise your arm overhead, whether you have pain or not, that space closes down on those tendons. That is a normal movement to have. So if someone's telling you your shoulder pain is coming from that space closing down, then how can they explain every single other person having that same space closing down but not having pain, right? So taking a very simplistic view on pain is almost a road that leads to a lot of frustration, because then say you go get an MRI is completely clean, right? You get this MRI and you say, well, what's wrong? Then you have no answers, right? But realistically, a clean MRI is one of the best things you can have, right? A clean slate of health. But some people look at that and be like, well, I've been told I have this, now I'm back at square one. Now they're more frustrated. So the words that practitioners say to you and the words you read online, whether it's WebMD or another person, take them with a grain of salt. Look at everything with a little bit of healthy skepticism, because the person making those claims, whether it's me or someone else, should have the burden of proof is on them, not on you to believe them and disprove them. They should be able to prove what they're talking about. So some myths that we talk about with the knees, one of the biggest ones we see is not letting the knees go over toes during training. So there was a study that was done that this whole debate was kind of sparked around, right? So the debate was sparked around a study that they did. They had two different groups of people squat. One group just squatted normally, knees going over the toes. The other group had a box in front of them or a wall, so they couldn't squat with their knees over their toes. And what they found was in the group that let the knees go over the toes, there was about a 40% increase in stress at the knee biomechanically. And then all these biomechanists look at that movement pattern and say, oh, there it is. That's what increases stress of the knee. Let's stop doing that. But they didn't look at when they don't let the knees go over the toes, okay, they're taking 40% of stress off the knees, but where's that stress going? They found that stress was actually displaced to the hip and lower back, and 1,000% increase at the hip and lower back. And to me, when I'm squatting with my knees letting go over my toes and get 40% increase, that's an easy trade-off to avoid 1,000% increase in stress here, lifting the same weight, doing the same movement pattern. So everything needs to have some context behind it. Looking at numbers and saying, I need to believe this number because this number is right, there always needs to be context behind it, or else you're believing information that might not apply to you specifically, or you're losing out on another possible benefit, right? So when we talk about pain in itself, there's a lot more science, a lot more studies being done on pain and what it actually means to people that are actually having pain. Like I said, there's people out there that have pain that's almost unexplainable, right? And when it comes to pain, we have to understand that it doesn't always mean something's being damaged or injured. That, if you take anything away from my talk today, that's the number one point. When you have pain, it's normal to have pain at certain points of your life, and it doesn't mean you're damaged or injured all the time, right? There's people out there that, I'm sure we've heard of phantom limb syndrome, where they have their whole arm chopped off or leg amputated, and they still have pain in that leg, and that leg doesn't even exist anymore. Right? So understanding that pain is a construct of how the body views, how the brain views the body. Without a brain, there is no pain, right? So pain is not an input. I don't have pain receptors in my body. I have receptors in my body that I can gather information from. That all goes to my brain, and my brain decides, hey, is it a good time for this person to feel pain or not? If I'm walking across a busy street, I twist my ankle, I'm not going to sit there, crying about my ankle. My body's not going to let me feel pain. It's going to make me get up and get out of that busy road before I get hit by a bus, right? But if I'm walking in a nice field of flowers, I twist my ankle, I might have more time to focus on that area, right? So with the same kind of injury, having different kinds of pain kind of shows you that it's not 100% correlated when it comes to pain and what you see on an MRI or an X-ray, right? And the other thing I want to talk about as well is a lot of people talk about what's the harm in getting an MRI? Why can't I just see what the inside of my body kind of looks like? They've done studies and shown that when you get an early MRI before it's warranted, before you've tried the good non-invasive route, your chances of getting injections or surgeries in the low back increase anywhere from 13 to 26 times higher. So for the same kind of symptoms that somebody else is feeling, whether it's low back pain or pain down the leg, whatever it is, your chances of getting injections and surgery and more invasive procedures that may or may not work increase substantially because you have an early MRI. So when somebody just wants to see the inside of your body, a lot of times it's because to either appease you as a firefighter because you want the MRI, that healthcare practitioner should be fighting for you to not get an early MRI. There's certain things that, okay, MRI or X-ray is pretty required, but for the most case, low back pain, shoulder pain, knee pain generally isn't the best idea to get MRI without doing the prerequisite kind of non-invasive procedures first. All right? So as we kind of move along the firefighter spectrum, right? What we've seen for the most part is every time a firefighter comes in to see us, we ask for the first question, how long have you been dealing with the issue you come in for? I would say maybe 95% of the time it's over 2 to 3 years that they've been dealing with the same issue without getting that help. And it's a constant theme that we've seen throughout every single presentation that we've talked about today. You have support systems, you have ways to get help. Please, please, please use them, because every single person that's come up and talked, we care about you as a person and as firefighters. We know the service you provide to this city and to this county is huge. And without you, the system kind of breaks down. So whatever we can do to help, we're here to help. But you need to take the first step and ask for that help or get referred to somebody that can help you guys out. And that is the most important thing, because the thing that we've seen with firefighters that don't want help, if you have to drag them into door, you have to drag them around the place. So, and that's not fun for anybody, right? To work with someone that doesn't want to be there. So first you have to kind of shift that mindset on, I have to deal with this pain. This pain is just a normal part of firefighter culture. That's not necessarily true. So let's kind of try to break that mold and go ask for help when you need help. Okay. So in conclusion, like we've talked about, pain doesn't necessarily mean damage. You have a very, very good network, at least in Las Vegas specifically, and whoever else watches this, I'm sure you have people around you, healthcare practitioners, your brothers and sisters that really, really care about you. Lean on them more and more. Pain is not just a biological construct. We look at it as a biopsychosocial construct. There's a lot of psychology that goes into it and a big social construct behind it as well. So please, if you're dealing with any of the stuff we've talked about, get the help you need. I hope this information is beneficial to some people to at least get that started. Because I can't sit here and tell you the exact movement that is going to help you without assessing you. And that comes from you first taking the step and getting the help you need. So thank you. And any questions at all? Cool. All right. Thank you, guys.